All right, so let's go back to this slide that we reviewed at the beginning of the talk. So we've made the diagnosis, we've had functional impairment, we've treated it, we were in the early stages, patients had a robust response to levodopa. The response is smooth, they take a dose, it lasts well beyond the next dose. They don't notice any fluctuations in the response. There isn't any time that they're waiting for a dose to kick in or a dose has worn off. It's a very smooth, early honeymoon period, if you will. Then over time, we develop the motor complications. These are the fluctuating responses to levodopa. When the levodopa's benefit has diminished and we have the reemergence or worsening of symptoms that have been controlled with levodopa, these are so-called off episodes. These may be associated with dyskinesias. These are the twisting, turning movements that you might have seen patients demonstrate. This can occur at the peak of the effect of a levodopa dose or when levodopa is kicking in or wearing off. And so these motor complications, off episodes, dyskinesias, occur in the majority of patients after 5 to 10 years of treatment with levodopa. These motor complications are believed to be related to both peripheral effects as well as central causes. The central cause, the progression of the disease, so more and more loss of those dopamine-producing cells, as well as the intermittent stimulation of those postsynaptic dopamine cells we looked at in that one schematic slide. That intermittent stimulation, you're giving the drug and you stimulate, then it's some time until the next dose and you stimulate again. This intermittent stimulation along with the progressive loss of the cells are believed to be the reasons for these motor complications. The peripheral challenges include many that are listed here on the slide. And so when we take a dose of levodopa, a patient takes a dose of levodopa, there are many places in which the absorption and delivery to the brain can be impaired. First, getting the tablet down into the stomach can be impaired because of swallowing problems. If we go to the the bottom right, once it gets into the stomach, there can be slowed movement of the stomach, so gastroparesis, delayed emptying. And since levodopa is absorbed in the intestine, levodopa has to get through the stomach in order to get absorbed. And so if the stomach is slow, or there's food in the stomach, particularly fatty foods that further slow GI motility, there can be impairment of getting that tablet of levodopa to the intestine. Once it gets to the intestine, the levodopa is an amino acid-like substance, and so it competes with other amino acids which are part of proteins that are part of their meals. And so there can be competition to get across the intestinal wall, competing with the amino acids found in the protein content of food. This competition also can include, now we're at the top right, at the blood-brain barrier. And so it competes with amino acids to get across that blood-brain barrier that we saw at that earlier slide. And now if we go to the bottom left, there can also be small intestinal bacterial overgrowth. So the type of bacteria and the overgrowth of bacteria, of certain bacteria, can occur in Parkinson's disease. And this sets up a hostile environment for the absorption of levodopa. So all of these peripheral factors can affect the occurrence of those motor complications. All right, so when we talk about off episodes, and it's important to recognize what we're talking about. I mentioned it briefly in a previous slide. So let's first talk about on, and then we can talk about off. So on, being on, occurs when levodopa is providing its typical benefit and the symptoms are reasonably well controlled. And thus, an off episode is a temporary change in the clinical state of a patient when the motor and non-motor symptoms that were improved with levodopa return or worsen. And the combination and severity of those symptoms are unique to each patient. And so an off episode is not going to be the same from patient to patient. So whatever symptoms the patient experiences and those symptoms that improve with levodopa, when those symptoms reemerge or worsen, that is that patient's off episode. And because of this complexity, they may go unrecognized or underreported by both physicians and patients respectively. All right, so let's look at this in detail. So on the far left is the early patients who is first taking levodopa. You see the levodopa arrow on the bottom left of that graph. So they take that dose and they quickly get into that green phase. So that dotted line, the in between those two dotted lines, that is the on response. The yellow is the off episode, off time. Above the top dotted line would be the dyskinesias. So you see the patient takes the levodopa dose. Very quickly, they get into that green zone, so they're on. And that on lasts hours, over 4 or 5 hours in this case. As the disease progresses, you see that same levodopa dose. You see the slope is much greater. It takes a longer time to get into that on phase, the light green phase. And some patients may develop dyskinesias, that dark green at the peak effect of that dose. And the duration of action of that individual dose is diminished. Now we're only being in the on for about 2-3 hours. And as the disease advances even further, you see all of that being exaggerated. There's a longer time to get into the on phase. The on phase is shorter, and the patient, in order to be on, has the dyskinesias. We're in the dark green the whole time, we're in the light green, and the duration of a benefit of that dose is an hour or 2 hours. And so this is the evolution of those motor complications we described. Now, these off episodes are nearly universal and occur in about 10% of patients per year of treatment. And so by 9 years of treatment, 70% of patients have these off episodes. And in a survey conducted by the Michael J. Fox Foundation of over 3,000 patients, over 90% of those self-reported as having at least one off episode a day. And in this same study, you'll see that 22.8% had 3 episodes a day, 10% 4 episodes a day, and almost another 10% more than 4 episodes of these off times throughout the day. Now, there are different kinds of off episodes that are both predictable and unpredictable. So here are the predictable ones. So the last dose you see on the far right for each day for this patient is at 1900, so 7 p.m. So they take that dose, they go to bed sometime thereafter, and then they wake up at 6 a.m., the far left now we're looking at. So they wake up and we're in that off state because that last dose the night before has worn off. They wake up with morning akinesia, morning slowness. They take their 7 o'clock dose represented by the triangle, the green triangle, and you see there's a delayed on until they get into that grade zone, the on stage. So they not only woke up slow, but they have a delayed response to that first dose. And they finally get into the gray and they're on. And then that 7 a.m. dose has worn off before that 10 a.m. dose. They take the 10 a.m. dose, maybe they ate breakfast at 9 o'clock. So now that dose of levodopa at 10 a.m. is sitting in the stomach and they get no on from that dose. So they stay in the off phase. They wait until their 1 p.m. dose. They take their 1 p.m. dose. They have a nice response. They quickly get into the on, but they have some dyskinesias associated with this dose. That 1 p.m. dose wears off before the 4 p.m. dose. They take their 4 p.m. dose. They get a response, a reasonable time, but it isn't a full on. They get a partial on. So all of these are different types of off that may occur in a patient. as it relates to a predictable response or lack of response to a levodopa dose. Now, they may also be unpredictable where they're not related to the actual time. Now, the morning off that I related, the morning akinesia and that delayed on of that first dose is very common and may cause significant disability, occurring in nearly 60% of Parkinson patients at any stage of the disease. We look at the top right, for 38% of patients in one study, it occurred daily. Every day they had the morning off in almost 40% of patients. And this morning off caused significant disability and had a negative impact on health-related quality of life, and in certain cases may necessitate more help from caregivers associated with the disease. Okay, so let's focus just again on the response to levodopa. So the predominant predictable offs are a delay in a response to a dose and the wearing off of a response that has been received. So in this study, looking at time spent in off, the time waiting for a dose to kick in was twice as long as the time of wearing off of a dose. So you take the dose of levodopa, the arrow, and the wait, the time to on was a significant contribute to these off episodes. The hump represents the response to levodopa, and then on the right is the wearing off of that response. Now, if levodopa never kicks in, you won't have a wearing off. And so any agent that tries to extend the duration of that on, if it can't cause the patient to go on, you can't extend an on that hasn't occurred. So it's important to recognize these two components of off, the time to on and the wearing off of an on that has occurred. And these delayed ons and sometimes no ons are common as part of the morning off. And in this report, 51% of patients had at least one delayed on in the morning. And 33% had at least one dose failure, a dose that never kicked in, so a no on. 21% of patients had a delayed on every morning. And when waiting for the on to occur, the mean time was 35 to 40 minutes, and 56% had a delay of at least 30 minutes. In 10% of patients, they had 4 or more dose failures across the week. So this component, this delayed on or no on, can be very problematic, not only for the morning off, but as associated with any dose of levodopa throughout the day. All right, so this fluctuating response to treatment, these off episodes, were described in this survey of patients as being the most troublesome symptom. There were other symptoms that were noted to be troublesome, including mood, drooling, sleep problems, but this fluctuating response to medication was noted as the most troublesome symptom.